Are you tired of those stubborn blackheads that just keep coming back no matter what you try? It can be incredibly frustrating, but here's a secret. The problem isn't your skin, it's your technique. Blackheads, or open comedones, are essentially oxidized plugs of sebum and dead skin cells that have become lodged in your pores. When this mixture is exposed to air, it oxidizes and turns dark. The key to getting rid of them isn't to scrub them away aggressively, but to gently dissolve and lift them from within the pore. Today, we're going to walk you through a professional, barrier-safe routine designed not just to clear existing blackheads, but to prevent them from returning, giving you lasting results. First, we must prepare the skin. This step is absolutely non-negotiable for safe and effective extractions. Our goal is to soften the hardened plugs of sebum. Take a clean washcloth, run it under comfortably warm, not hot water, and lay it over your T-zone for 3 to 5 minutes. This gentle warmth and moisture make the plugs pliable, so they'll release with minimal pressure, reducing the risk of irritation. For an optional boost, you can steep a green tea bag in the water first. Its antioxidants offer wonderful soothing benefits. After steaming, gently pat the area dry with a clean towel. Now, we begin the double cleanse, a cornerstone of deep pore cleaning. We start with an oil cleanser, based on the scientific principle, like dissolves like. Oil-based cleansers are brilliant at breaking down oil-based impurities like makeup, sunscreen, and the sebum in your blackheads. Apply the oil to your dry skin and massage for a full 60 seconds, really focusing on congested areas like the nose, chin, and forehead. This physical massage helps to physically loosen the plugs. Then, add a little water to emulsify the oil into a milky liquid and rinse thoroughly. For your second cleanse, use a water-based cleanser for another 60 seconds. This step removes any remaining residue and water-based impurities. For blackhead-prone skin, look for a cleanser with salicylic acid, a beta-hydroxy acid or BHA that is oil-soluble and can penetrate deep inside the pore to dissolve debris from within. Pay close attention to how your skin feels after rinsing. If it feels tight, stripped, or squeaky clean, that's a clear sign of barrier stress. Your cleanser is too harsh. Switch to a gentler, pH-balanced option to protect your skin's delicate moisture barrier. Next is targeted chemical exfoliation. This is where we really treat the problem at its source. For blackhead-prone zones, use a BHA toner with 0.5 to 1% salicylic acid. Apply it 2 to 4 times a week, only in the evening, to keep pores clear. For more sensitive areas of your face, or if you're new to acids, opt for a gentler acid like PHAs or lactic acid 1 to 3 times per week. These have larger molecules and work on the skin's surface, offering a milder exfoliation. A critical rule we must emphasize: no gritty physical scrubs on your face. While they might feel satisfying, the sharp, irregular particles in many scrubs can create microscopic tears in your skin. This damages your precious skin barrier, leading to inflammation, increased sensitivity, and ironically, can trigger even more oil production and clogging. Once a week, treat your skin to a deep cleaning mask. A DIY blend can be incredibly effective. Mix a base of a gentle clay, like kaolin, with a pinch of a powder enzyme, such as papaya or pineapple. These enzymes help dissolve the protein bonds holding dead skin cells together. Activate the mask with cooled green tea for its potent anti-inflammatory benefits. Apply this paste only to your congested zones and leave it on for 8 to 10 minutes. The key is to rinse it off when it's about 80% dry. Still slightly tacky to the touch. Letting a clay mask dry completely can strip moisture and dehydrate your skin. Now for optional manual extractions. This step must be done with extreme care and only after your skin has been properly prepped. Always start with clean hands and either sanitize your tool with rubbing alcohol or wrap your fingers in fresh tissue to create a sterile, gentle barrier. The technique is absolutely crucial to avoid damaging your skin. Place your tool or tissue-wrapped fingers on either side of the blackhead. Apply gentle, downward and inward pressure with a slow, rocking motion. The goal is to coax the plug out from below, not to force it by pressing straight down. Be patient and gentle. Always follow the rule of twos. If the blackhead doesn't lift after 2 gentle attempts, stop. Forcing it will only lead to inflammation, potential scarring, and post-inflammatory hyperpigmentation, or PIH. For inflamed blemishes like whiteheads that aren't at the surface, never, ever squeeze them. This can push bacteria deeper into the skin. Instead, apply a hydrocolloid patch overnight. It will absorb fluid and impurities, bringing the blemish to a head safely. Immediately after extractions, it's time for post-care to calm and protect the skin. Apply a localized swipe of salicylic acid directly onto the extracted pore to disinfect it. Then, glide an ice roller or a cold compress over the area for 30 to 45 seconds to constrict blood vessels and reduce redness. Next, drench your skin in soothing hydration. Use a mist or toner packed with calming ingredients like Centella asiatica, heartleaf, or panthenol to begin repairing the skin barrier right away. Now, it's time to choose one targeted treatment to address your primary concerns. If your skin is predominantly oily and you want to minimize the appearance of pores, choose a niacinamide serum. It's a fantastic ingredient for regulating oil production and refining skin texture. If you're dealing with post-extraction redness or lingering dark marks, apply a thin layer of azelaic acid. It has anti-inflammatory properties to calm skin and helps to even out skin tone over time. Finally, the most important step to lock everything in: a lightweight, non-comedogenic gel moisturizer. Look for one formulated with humectants like hyaluronic acid to draw in moisture, and barrier-supporting ingredients like ceramides to strengthen your skin's defenses. Properly hydrated skin is balanced skin. When your skin is balanced, it's less likely to overproduce oil, which means it's less likely to create new blackheads. To maintain your clear skin, consistency is everything. Your morning routine should be simple and focused on protection. A gentle cleanse, a soothing toner, your chosen targeted serum, your gel moisturizer, and always finish with a non-comedogenic sunscreen with at least SPF 30. Sun protection is non-negotiable, as it prevents dark marks from forming and protects your skin from damage. Your evening routine is where you'll cycle your active ingredients to treat and prevent congestion without overwhelming your skin. On night A, use your BHA exfoliant on targeted zones to keep pores clear. On night B, use a retinoid, like over-the-counter adapalene. Apply just a pea-sized amount to your entire face. Retinoids are powerful ingredients that speed up cell turnover, preventing dead skin cells from clogging pores in the first place. Night C is your recovery night. No strong actives at all. Focus only on hydration and repair with soothing serums and your moisturizer. Then, repeat the cycle. A crucial safety note: never stack your retinoid with other strong acids like BHA or AHA in the same routine, as this can lead to severe irritation. Don't forget that small lifestyle habits make a huge difference. Change your pillowcase frequently to avoid transferring oils and bacteria back to your skin. Wipe down your phone screen daily. It's a magnet for grime. Always cleanse your face after a workout to remove sweat and bacteria. Clean your makeup brushes weekly to prevent product buildup. Be mindful of applying heavy, occlusive creams on your T-zone if you're prone to congestion. And perhaps most importantly, do your best to keep your hands off your face to prevent transferring dirt and bacteria. So what kind of results can you realistically expect with this consistent routine? Within 48 hours of your first deep cleanse, you'll notice calmer, less inflamed skin, especially if you performed extractions. After about 7 to 10 days of following the AM/PM cycles, you'll start to see a smoother skin texture with fewer new plugs forming. And by the 4-week mark, as your skin cell turnover cycle regulates, you will see a visibly reduced blackhead cycle. This routine is designed for long-term success by clearing existing congestion and preventing new clogs from forming. If you're ready to finally break the blackhead cycle and achieve clearer, healthier skin, drop a emoji in the comments below. We'd love to hear from you. And don't forget to like this video and subscribe for more barrier-safe skincare advice that actually works.